Today, we're going to take a journey, but not to some far-off place. We're going deep inside our own bodies to explore this incredible, hidden, tree-like structure that's responsible for every single breath you take.
So let me ask you something. What do you picture when you think about what's really inside your lungs? I mean, beyond just, a couple of bags that fill up with air. What's the actual architecture in there?
Well, believe it or not, the answer is basically an upside-down tree. It's this amazingly complex network that starts with a single trunk and just keeps branching and branching and branching, up to 25 times before it reaches its final destination. It's wild.
Now, there's a technical name for this, of course, the tracheobronchial tree. It's pretty simple when you break it down. The trachea, that's your windpipe, acts as the trunk, and the bronchi are all the branches, big and small, that carry air deep into your lungs. Their one and only job is to get air where it needs to go.
Okay, so let's start at the top, with the biggest branches of this tree. These are the ones you might have heard of before. We're talking about the lobes of the lungs.
So here's how it all begins. Your trachea, the main trunk, comes down and splits in two at a point called the carina. That split creates the first two huge branches, the left and right main bronchi. One goes into the left lung, one goes into the right. And from there, they immediately start dividing again into what are called secondary bronchi, one for each of the lobes.
And right away, things get interesting, because our two lungs are not identical twins. The right lung is a little bigger, with 3 lobes, while the left lung only has 2. Why? Well, your left lung has to make some room for your heart, creating a little indentation called the cardiac notch. This size difference even affects the airways. The right main bronchus is wider and points downward more vertically. And that little anatomical detail, well, it actually has some pretty big real-world consequences, which we'll get to in just a minute.
So, okay, we've got lobes, but that's just scratching the surface. There's a much more detailed, much more intricate map hidden inside those lobes that you just can't see from the outside.
Yeah, you see, the lobes are separated by these visible grooves or fissures, but this next level of organization, it's totally invisible from the surface. If you could actually look inside, though, you'd see that each lobe is neatly divided into these incredible self-contained functional districts.
So how many of these districts are we talking about? Well, in your right lung, there are 10 of them. 10 distinct, fully operational units, all packed neatly inside those 3 lobes.
And over in the left lung, there are just a few less, usually 8 or 9. The reason for the range is that sometimes a couple of these segments actually fuse together as they develop.
So, what exactly is a bronchopulmonary segment? This is the key. Think of it as the largest functional piece of a lobe, and the two most important words here are independent and self-contained. It's like a single apartment in a big building. It has its own plumbing, its own wiring, everything it needs to function all by itself.
And here's what that independence looks like. Each and every segment gets its own personal airway. That's a tertiary bronchus. It also gets its own dedicated branch of the pulmonary artery, bringing in blood that needs oxygen. Then, they're walled off from their neighbors by connective tissue. And what's really cool is that the veins carrying the newly oxygenated blood away actually run in the walls between the segments.
Now, this is all fascinating stuff for sure, but why does this hidden map actually matter? I mean, what's the practical application? This is where it gets really important.
Let's circle back to that asymmetry we mentioned earlier, the wider, straighter bronchus on the right. Imagine someone accidentally inhales something small, like a peanut. It travels down the windpipe and hits that fork in the road, the carina. So where is it going to go? Well, because the path into the right lung is basically a straighter shot downwards, gravity and momentum make it the path of least resistance. That peanut is far, far more likely to end up in the right lung. It's a simple anatomical fact with huge clinical implication.
But here's the biggest implication of all. This quote really says it all. The fact that each one of these segments is functionally separate, well, that's an absolute game changer from modern medicine.
Because if one of those little apartments gets sick, say with a small tumor or a localized infection, a surgeon doesn't have to condemn the whole building. They don't have to take out the entire lobe. They can be incredibly precise.
The procedure is called a segmentectomy, and it's exactly what it sounds like. Surgeons can go in and remove just that one affected segment. And because it has its own dedicated air and blood supply and its own walls, taking it out doesn't damage the healthy, functioning neighbors right next door. This is what we call lung-sparing surgery, and it is entirely possible because of this elegant hidden. Okay, so we've traveled from the main trunk of our tree, down through the big branches, and into these amazing little functional districts. But where's the end of the line? What is the final destination for the air we breathe?
After all of those divisions, sometimes up to 25 of them, the airways become impossibly small. They're now microscopic passages that finally end in these little clusters of tiny, delicate air sacs.
And these are the alveoli. This is it. This is the entire reason this whole complex tree structure even exists. The alveoli are where the magic happens. It's the blood-air barrier, where the walls are so incredibly thin that oxygen can just slip right through from the air into your blood, and carbon dioxide can slip right back out. Every branch, every segment, it's all designed just to get air right here.
So, the next time you take a deep breath, just think about what's actually happening. You're not just filling up a balloon. You're sending air down this intricate 25-generation tree through perfectly organized districts, all to supply millions of tiny little sacs that are working to keep you alive. Isn't it just incredible that something so simple, so automatic, relies on such a complex and perfect hidden map right inside your own chest?